All right, switching gears now and on to the COVID-19 pandemic. The government has been urged to emphasize on the vaccination of children between the ages of 12 and 18 years against the virus as the country braces for the seventh wave of the pandemic that is currently underway. The seventh wave is expected to peak in December during the festive period, prompting calls for Kenyans to revert to wearing masks, washing hands and social distancing to help mitigate against the effects of the virus. Let's get more from our very own Brenda Wanga.
968 days since the first case of COVID-19 landed on Kenyan soil, and the disease, long declared a global pandemic, is still making its way around the country. The latest statistics from the Ministry of Health show a steady increase in the number of people infected by the virus. This despite some short-lived optimism that the worst of the pandemic might be over. 2 months, there has been a spike in infections. Towards the end of October, 34 out of 452 people tested positive for the virus. That figure increased to 101 out of 1,286 people testing positive last week, and rising to 15% positivity rate as of today, with 60 people testing positive from a sample size of 397. Medical experts say this is the seventh wave of the pandemic manifesting in the country.
You'll observe that there's a lot going on in terms of people having infections, flu-like infections. We are at the alert threshold of wave resurgence.
The COVID-19 Programs Director for the Lake Region Economic Bloc's modeling of this next phase of the pandemic paints a somewhat worrying picture. The projection indicates that the pandemic will see over 23,000 symptomatic cases that will require hospitalization and over 270,000 cases that will not show symptoms of the disease. The seventh wave is also projected to claim about 50 lives before it shows over. The wave begins when the country seems to have ignored the measures prescribed by the World Health Organization and the Ministry of Health to protect against the spread of the virus that has claimed over 5,600 lives so far. Medical practitioners are now calling on the government to strictly implement the prevention measures.
Public health measures against diseases, again, I would like to say, are common across the public health arena, including we have seen surges of cholera more recently, cholera outbreaks. And what we tell people is that public health measures should be employed all the time. They shouldn't be employed as you expect a surge. They should be natural ways of living. So washing hands is not done because of COVID. It should be something we do all the time. And you've seen a lot of people with food poisoning. You've seen cholera surges. It's because people are not washing their hands.
The wave that began early this month is expected to peak in mid-December and early January and end in mid-January and last for a total of 63 days. The peak of the wave is particularly worrying as it comes during the festive season.
Is obviously going to be rising. We expect that season we have more people getting infected. We expect to get more and more because there's movement. Because again, as we've said before, the COVID virus is transmitted by individuals. So you receive it, or I get it, I move, I infect other people. And the more you infect, the more geometric it goes. You infect one people, that person infects two, that two infects four. It goes like that. So because there is movement, there will be more infections.
There are increased calls for the Ministry of Health to ramp up its vaccination drive. So far, a total of 22.6 million Kenyans have been vaccinated, with 18 million of this being adults, 2.7 million children aged between 12 and 18, while 1.6 million Kenyans have received boosters of the vaccines. The vaccination drive now seeks to target the under-18s, as the experts say they are likely to act as reservoirs for the virus and spread it to the elderly and vulnerable in society. Brenda Wanga, Citizen TV, Nairobi.